Hello and welcome to the Girls Fuel podcast. My name is Haley. I'm a registered dietitian and nutrition coach here to help you along your health and fitness journey by providing evidence and experience-based knowledge, and as always, full transparency. I almost forgot the intro there for a second. It's been a minute since we recorded. Today, I am joined by Jess. How are you?
I'm great. How are you?
Living, surviving, doing the things. Today, we are going to talk all things We're going to talk about what Candida is, how you get rid of it naturally, as well as the connection with vaginal health, yeast infections, UTIs, and all of that fun stuff that we get to deal with as women. Speaking from personal experience here, I have had Candida multiple times in my GI tract, and Candida is a overgrowth of a fungus or yeast, and it's commonly referred to as intestinal Candida. Oh gosh, that's a mouthful. Candidiasis. Can you pronounce that word? Dyslexia.
Yeah, no.
I
Can
know.
Candid Candida
Jess and I were just talking before we hopped on about like neurodivergence and how we're like the same with like our ADHD and all of these things. And apparently I just learned that you're also low-key dyslexic. So we learn something new every day, but you guys get the idea. We're going to talk all things Candida, and basically what can happen is that Candida fungus, it is present in all of us. We all have it in what would be considered normal, undetectable amounts. However, when we have that excessive growth of this Candida yeast, especially in the intestines, we will have a good variety of symptoms that can also impact our mouth. We already talked about our gut, our skin, as well as our vaginal health. And when this Candida is present, oftentimes it can be a little bit harder to detect. So we're going to share kind of our experiences with coaching clients that have had this Candida, as well as like I've had it multiple times. And when we think about, well, why did these kind of infections happen in the first place? A lot of it, and Jess and I were just talking about this, has to do with your environment that you grew up in, as well as your immune system. So Jess, tell us a little bit more about those environmental factors.
Yeah, so a couple things, like, of course, first of all, I have a question. Is there a genetic component too? Like, can you have a genetic predisposition for Candida, or is that a thing?
I honestly don't know the answer to that question. I'm unsure if it can be genetic. What we do see a lot is having GI issues is genetic, right? Like I know a lot of our clients
Yeah,
that will say, I've been diagnosed with IBS. I've
yeah.
had GI issues my whole life. I'm like, oh, do either of your parents? And they're like, oh yeah, usually one, if not both, do.
Have.
So I wouldn't be surprised. And obviously, when we're talking about one specific overgrowth or infection, but they do all tie together in the boat of having an issue with our digestive tract, an issue with our gut health, so to speak.
Okay, awesome. Yeah, I'm just curious because I feel like genetics keeps coming up in conversations about gut issues and things like this. Anyways, so environmental factors that can cause Candida. So antibiotics is one of them, and a weakened immune state as well for stress. So that can lead to hormonal imbalances, elevated cortisol, and then it affects gut health and then promotes Candida overgrowth. Excessive sugar intake and a low fiber diet. So, but I think you're more talking about like refined sugars,
Yeah,
right?
like
Yeah, so like standard American diet type foods, lots of like white breads, and in terms of sugar intake, like fruit juices can have a lot of sugar if they're not like naturally sourced, and also just sugar in sauces. There's lots of sugar components of sugar in food that you wouldn't think.
yeah,
Medications, so like medications for asthma and autoimmune, so corticosteroid medications. Birth control is a big one, and I've also experienced this as well. When I took birth control, I would have a yeast infection like every month, and I could never pinpoint it when I was younger. I just thought that it was, and then my mom and my grandma were like, yeah, I had this, I had that too. Don't worry about it. And I never put two and two together. Diabetes, or if you can't control, or if you have uncontrolled blood sugar, and then gut dysbiosis and leaky gut.
definitely. And this goes for a lot of GI infections that you'll hear us talk about. And I've been talking with a lot of you in the Instagram DMs recently since I've been doing more like polls and things like that about what these symptoms, what certain symptoms can really mean, and how a lot of times where our doctors are just looking for those band-aid approaches because they don't know to dig deeper. And Candida is definitely one of those things. Like when I list the symptoms, I'll be really curious to know like how many of these you think you experience, because I feel like I had Candida for a really long time and I just never had the education or the resources available to figure out what it was. So, how do we tell if we have Candida? One of the biggest signs is going to be oral thrush, white coating on your tongue. It can often occur also on the insides of your cheek walls. Some bumps might be present. And I'm talking like day after day, because it is common for people to have a white coating on their tongue, oral thrush after a set, like a round of antibiotics. That could be that Candida overgrowth starting to occur in our oral cavity, because again, Candida lives in us. It's in our mouth, it's in our skin, it's in our GI tract, and it's in our vaginal cavity. It just stays in balance with everything else until a stressor comes and changes something in your microbiome in your oral cavity. So oral thrush was one of the main reasons why I started digging deeper, because I was like, there's no way my tongue should look like this. It was like white, yellow. It was disgusting, honestly. And it would scrape off. And then with Candida, digestive changes are also really common. However, what I've seen in practice, and this is how it was with myself, is Candida symptoms aren't usually super aggressive with the GI tract. I noticed personally, and again with clients, where it isn't necessarily every day that you feel like you have GI symptoms. Like for me, this is probably why it went undetected for so long. And I was just told, hey, you probably have IBS, take a laxative, take fiber, whatever it is, because I would go back and forth between constipated and loose stool very frequently throughout the week. So I was like, oh, I'm backed up for a few days, but then I go. So it's fine. That's normal, right? Not normal at all. And that's actually why sometimes we'll end up testing our clients for Candida, because we'll see in their like week to week logs where they're telling us what their Bristol stool chart, what their stool's looking like. And I'm like, all right, like you're going, that's great, but you shouldn't be having like a 1, 1, 1, 6. We shouldn't be like rabbit turd explosive diarrhea, right? That is not normal. And that's a big common one in Candida, where it will be that fluctuation. Bloating can happen for some people. Gas is another one. And then just general abdominal discomfort. This is actually how I knew that it reoccurred for me, because I was having those really strange, like low belly, pinchy tummy aches and burning sensations and things like that. Some other signs that people might experience are going to be excess, like intensive cravings for sugar and carbs, because those things feed the yeast, and brain gut connection is strong. So if the Candida is present, it is going to send those signals. Your body is going to be in a stress state as it is, and it's going to be looking for quick energy. And again, that will feed and exacerbate the Candida. So that's why if you are suspecting Candida, one of the first things that you should do is reduce sugar and yeast from your diet. And we'll talk about more of what to do from there. But another common one with Candida, and I experienced this so hard, was fatigue, like chronic fatigue to the point of just like feeling drained all the time, no matter how much you sleep, no matter how much caffeine you drink or whatever you try to do. It can also come with mood changes, specifically brain fog, trouble focusing, and memory issues. And girl, I thought I was crazy when I was having all these issues. I also have an ADHD diagnosis, so fair for some of them, but it was like next level inability to think clearly. And that was one of the first things that did clear up once I started naturally treating my Candida. Vaginal yeast infections, and these aren't for everyone. Like I've only had one yeast infection in my life, but I do have clients that will have them very regularly. And then another one is going to be congestion, sinus issues, postnasal drip, itchy skin. I was always itchy because Candida can also trigger some histamine production. But when it comes to symptoms, Candida is a tricky one for sure. And that's where, if you are somebody that's been experiencing symptoms for a long time, one of the first things that I'd recommend doing is keeping like a log of them day to day when things happen. I always tell my girls when we do this together, don't drive yourself crazy, but get some awareness around it.
Yeah, I like that, Haley. And just also too, on every single assessment I've done, it's always check your mouth, check your tongue for like bumps, the thrush, getting into the habit of checking these things and just being so aware of what your body's doing and what symptoms you have. Okay, yes, having a yeast infection and being tired, it's hard to connect those two. But if you can be aware of these things, then it's easier to connect the dots. Would you agree?
Oh, yeah, for sure. And it's definitely a fine line where we want awareness, but we don't want to be so obsessive over our symptoms. And I feel like that's where just like having a coach or
Totally.
having somebody that you can talk to today
Yeah.
is going to be helpful in order to actually see, like, all right, what is going on? What's actually changing? Is this getting better? Is it not? Because it can be really hard. And that's why I've hired coaches to deal with these issues with me, because it can be really hard to be objective when it comes to yourself because there's so much emotion attached to it. But building the routine of just even monitoring, is my shit actually normal? Am I actually pooping as much as I should be? Or am I going through that cycle of being constipated and then having these larger bowel movements that only occur once or twice a week, right? Because it may feel normal because you're
Yeah.
like, I'm going, but is it actually normal? Is the question with Candida. And then when it comes to what causes Candida, Jess already mentioned these, but the big one to highlight is going to be like history of antibiotic use or just like frequent use as it is. And again, I see this a lot with clients where they do have to take an antibiotic because of a strep throat or a sinus infection or something like that, that just we try to manage naturally. But at a certain point, there's only so much you can do besides long term getting your immune system in a better place. But antibiotics can be especially risky for Candida because they can cause the Candida albicans, which are a species of the yeast, to multiply and cross the intestinal wall. Because of this multiplication, it creates very unfavorable conditions and systemic inflammation. And you might feel this, like other symptoms that are associated with an infection like this one might be like puffiness in your face. I had like really big eye bags. My eyes are like that genetically, but it was like noticeably like hard to open my eyes all the way sometimes. My eyes were always really dry. I just didn't feel as tight in my body, as well as obviously all the symptoms that were not fun at all. Candida, you might Google Candida and you might also see that systemic candiditis, or however the hell you say it, can also be really dangerous and fatal. But however, that's more of like a thing where if you're in the hospital and you're like septic, like we see Candida all the time and people live their life not knowing they have it, but wondering why they have all these symptoms because your doctor doesn't test for Candida. I actually recently, when I had Candida, oh gosh, what was this, like 6 months ago? And I had an inkling, I was
I
like,
remember.
we need to do a GI map again. And there are multiple ways to test for Candida, which we'll talk about. But I was like, all right, I think some symptoms are happening. I thought I had H. pylori originally, but it turned out to be Candida again. The thrush was coming back. I had those light tummy aches, brain fog. My ADHD and anxiety were also at like next
Mm.
level, which can be another sign that something is off in your body, especially if you are someone that already struggles with your mental health. That's something that I'd ask you is when did you start having these high levels of anxiety? Because if it was in the recent years, maybe you weren't always so anxious. Like I was always anxious. I didn't realize it at the time, but thinking back to my childhood, I was a hot mess. Like I was so scared of things, but it definitely got a lot worse when I was having all of these other issues, and totally understand like the health stress as well. But having heightened like mental health symptoms more than usual without any other real changes to your day to day, your routines, whatever, can be a sign that something's off with your digestion. I see that a lot with parasites as well, because we think about it and something is overgrown in you that shouldn't be there. So your body may not know how to tell you directly, symptoms, obviously, but that heightened mental health response is another sign that things could be off. But again, back to what causes it, the antibiotics are going to be big, but then also just having a weakened immune system. And I think I say this a lot. We actually have an episode scheduled later next month to talk about what is our immune system? How does it operate? What does it really mean outside of I'm sick versus I'm not? But having a weakened immune state, and that can happen for a variety of reasons, medication use, just not taking the best care of yourself, under eating, alcohol, whatever, can cause your gut to not be able to regulate itself the right way. Because realistically, a healthy GI tract comes across overgrowth all the time. It just is able to use its good gut bugs, its immune function, its stomach acid to regulate and make sure they don't get out of hand. However, if we have some immune issues or pre-existing GI issues, our body's under too much stress, we're not giving it the resources it needs. So the diet, the supplements, so whatever it is, things will get out of hand. And that also ties into stress and that hormonal imbalance as well. So moral of the story, if you think you might have some of these symptoms and you feel like you're racking your brain wondering why, it might be a smart idea to assess for Candida. As far as testing goes, the GI map does test for Candida. It tests for Candida and about 5 or 6 other species of fungi yeast in the GI tract. However, I've had it be very I've had it show Candida for clients that I suspected had it, but there are other methods of testing. The oats organic acids test is another one, and that one is one that I'm learning more about at the moment that tests more for like breakdown products of the yeast and the fungi. It also will help us figure out if there's mold or bacterial dysbiosis. So that's another one that can be really great. As far as doctors testing this, from what I understand, they won't, because I started saying this earlier and then I got distracted. I went to my GI doc when I suspected Candida, and now she is a functional GI doc to a degree. She knows how to read the GI map. So I got lucky with her in that regard. This was not always the case though. And I showed her my GI map and I was like, I have some Candida again. Okay, what would you do here? And the typical treatment is an antifungal. So nystatin, fluconazole. The fluconazole has another name that it's escaping me. It's like diflucan or something like that. So that's typically what they recommend. And a lot of times that helps. But what I see with a lot of clients that go through that process is it just comes back because they're not addressing the other issues that opened you up to being susceptible for it. So the immune system. Are you taking the right probiotics? Are you giving your body the right vitamins and minerals in order to protect yourself from this overgrowth again? And then another big one is that leaky gut. Are we supporting intestinal permeability? So doctors will sometimes recognize Candida, especially if you have the oral thrush. They'll be like, okay, that's clear that there's something going on. But I've also had other doctors, including this one, be like, usually we don't do much about this. Like, it's thought to be normal to have yeast in us. And I'm like, is it normal to feel this way and have this happening to my vagina? I don't think so. And I know you've had yeast infections before too. They're freaking horrible.
Oh my gosh. When I was on birth control, I had one like once every month. And I just thought, oh, my doctor just said, oh, it's just genetic. Your mom and your grandma had it too. No one would help me. Horrible. And it's a very messy thing to have to deal with. And all I would do is the doctor just told me to go get some over the counter medication and pills and creams. So I lived on those creams and those pills. And it's crazy to think it back on it because it just it didn't fix anything, just like you said. You're not addressing the root environmental cause of it. I wasn't taking any supplements, no probiotics, things like that. And that's the typical route that people have to take because they don't know and you're not sure what resources you have available to you. So yeah, that was my experience. I want to ask you, are there specific strains of probiotics that you recommend, or is it going to be on a case-by-case basis, how severe it is, things like that?
It'll depend a little bit on symptoms. Typically, Sac Boulardii is my go-to for Candida. And now you might be thinking, if you're a coach listening to this, that is a yeast-based probiotic. And I'm like, I know, but it is not going to further the overgrowth. If anything, with Candida, we do have a lot of that systemic inflammation. We often also have that leaky gut. I also often see with liver, so high beta glucuronidase, just because there's that stress of your body trying to detox this excess fungal overgrowth. But with Sac Boulardii, the reason I really like it, especially if you do fluctuate between that constipation and diarrhea, it's probably my all-time favorite probiotic. You'll hear me talk about it in most podcasts because it's probably my most recommended. The only time I will not recommend it if somebody is really constipated. Like that is their main symptom because it's meant to help support regularity with diarrhea. So again, I'll use it if you teeter back and forth because it really does a great job of supporting the immune system, which we need desperately. So if you have that GI map and you have that low secretory IgA, and there are other symptoms of us like an unhealthy immune system besides getting sick a lot, like having any autoimmune like symptoms, which can be really broad because we think about autoimmune and I think we just think about, I don't know, what do you think about when you think about autoimmune? What's the first things that come to mind?
when I think about autoimmune, I'd say I think immediately. I feel like I've done too much research on this. But I just think about the body attacking yourself
Yeah.
when I think of autoimmune. But I've also done too much research.
And you're not a good person to ask. But I feel like
No.
people think about autoimmune and they think about something super severe and crazy like lupus or something. They're like, that won't happen to you.
Yeah.
But realistically, like
Yeah.
arthritis is an autoimmune issue. Some forms of arthritis, psoriasis, eczema, these are all like autoimmune things. Hashimoto's is another crazy common one. So having an autoimmune condition is a sign that there's something off with your immune system, and they'll often go hand in hand. But moral of the story, sac boulardii is one that will help with GI lining support. It'll help keep good bacteria in a solid place. If somebody is more prone to that constipation, and depending on if we have a zonulin marker, which is that leaky gut, I might do a spore-based bacteria or a just lactobacillus rhamnosus. And it also just depends. And this is why I like the GI map for Candida, because a lot of times we don't just have Candida. We might also have like bacterial overgrowth, and that kind of changes everything depending on where those symptoms are coming from. And I hope that this isn't too deep dive overwhelming if you're listening to this, but Candida is one that the symptoms will vary a good amount person to person. So I do find a probiotic to often be very helpful, especially if you are going to undergo any like antimicrobial, antifungal herbal supplements or an antibiotic, antifungal medical doctor ordeal. I do find that antifungals, because I've transparently taken an antifungal for Candida before, in addition to doing it naturally. The first time I had
Mm.
Candida, I treated it myself. Well, not treated because I'm not a doctor, but you get the idea. I did the whole 12-week protocol with the herbs. There's the anti-Candida diet. If there's literally go to candidadiet.com. And I think that is a great resource. It talks about limiting foods with added sugar, alcohol, gluten, and then focusing on foods that have antifungal properties that are anti-inflammatory, like non-starchy veggies, garlic, coconut oil. Coconut oil is a 10 out of 10 for fungal overgrowth.
Yeah.
I personally
I was
don't
gonna
like
say
the
that.
taste of it, so I don't cook with it. I'll do the oral wash, like oil, they call it oil pulling, I believe,
Yeah.
something like
Yeah.
that.
Yeah. Yeah. I know.
And I'll take it in a pill form, monolaurin, lorcidin. So coconut oil is fantastic. Supporting stomach acid is also going to be important. So apple cider vinegar, and then things that are going to reduce inflammation. So ginger, turmeric, cinnamon, lemon, and lime, things like that. But again, you'll also want to just evaluate if there might be any additional overgrowth, because if you also have a SIBO, for instance, you're going to have a hard time digesting foods like beans and cruciferous veggies, and they often do go together. So when it comes to diet, if you're like, oh my God, I have these symptoms, where do I start? I would say start looking at your food labels a little bit more, especially like if you're eating packaged foods, which are fine from time to time. We go by that 80-20 diet here, where 80% is super whole food, 20% we enjoy those more convenient snacky foods. Look at those. Typically, I'll recommend for the food label for per snack, try to limit sugar to 10 to 12 grams total, really focusing on limiting things that have high amounts of sugar that is added. And most food labels will say that. It'll say total sugar, and then it should say added sugar. That's what we want to just look out for. And then when you're reading a food label, we always want to go with the least ingredients possible. So starting by reducing sugar in your diet and reducing gluten. If you're already not doing gluten, I would go as far as reducing yeast, which is challenging just because a lot of even gluten-free breads and
Yeah.
things have yeast. And this is where I recommend getting tested, because if you don't have Candida, I personally, if I were you, wouldn't want to spend that much time really trying to avoid yeast. So that's where we can help with testing, or other online practitioners are probably going to be your best bet with that. Just because, again, a lot of like in-person traditional doctors won't test for Candida.
Question for you, Haley. If okay, so from my experience, I have probably had Candida, but I'm not sure, obviously, but when I went off birth control, changed up my diet, I just changed my lifestyle completely. Is there a way for Candida to just go away naturally if you just make all these changes to your lifestyle and environment and diet?
Yes, for sure. This is one that, assuming other things are in place and you don't have a ton of other existing GI abnormalities as far as overgrowths and infections, you can balance it on your own. However, it's not always that simple. Like I've had clients where they don't necessarily have the money or aren't in a place mentally where they can go through a protocol. So I will do
Mm.
just some gentle supplemental support and we'll do the dietary changes as well as diving into their other systems. How are your hormones? Because estrogen
Mm.
dominance can contribute to Candida overgrowth. Because when we have that high level of estrogen, Candida can actually produce a substance that mimics estrogen, leading to a exacerbated state of estrogen dominance. And this can disrupt our hormones. That's why some people with Candida will have exacerbated PMS, irregular cycle length, mood swings, even weight gain. But we also want to look at thyroid and liver. Is your body actively able to flush these things out on its own? Managing stress, which I know for you, you changed your lifestyle. I assume that also included better stress management and habits with caffeine and all these other things that were stimulating your nervous system.
Yeah, I know, absolutely. Yeah,
So
definitely
I,
a complete 180.
yep. So if
Oh,
that's where you're starting, it can make a big difference.
yeah, the other question, like I would also, this was back in the day when there was a lot more drinking going on and stuff like that. Have we talked about alcohol? Because I'm sure, like, what are your thoughts on alcohol and Candida?
Alcohol and Candida are a hard no. I learned that one the hard way.
Yeah.
And yes, alcohol will contribute to Candida overgrowth. Alcohol really will contribute to a lot of GI issues.
I
And
would
that's
think,
probably
yeah.
why I transparently ended up having a lot of them because I drank very heavily for many years in
Me
college. I
too.
mean, I think most of us did, right? At some point in our life. And
Yeah.
think about it, alcohol is a toxin. So hello, intestinal permeability and leaky gut, systemic inflammation, more autoimmune conditions, more potential for overgrowth, suppression of stomach acid. That's where it all starts. And that's why you need to know the why. Like, why are you susceptible to Candida? Because if we don't fix that why, you're not going to get rid of it for good. That's
Yeah.
why it came back for me because I wasn't doing enough to support my intestinal lining. My stress was still too high. I was relying on caffeine too much, thinking I was doing enough to support my body, but I wasn't. So it came back. And now, if you've had Candida in the past, or if you're in a place where you've probably overcome it to a degree without major intervention, there are things that we can keep in our lifestyle to help it stay away. So, like diet wise, assuming you don't also have SIBO symptoms, which would be that placebo, distension, bloating, gas, especially after eating fibrous meals, bloating that feels like it's for no reason. You've had SIBO. What
Mhm.
else?
What other things that I've had,
What other
you mean?
symptoms with SIBO?
Oh, yeah, no, I think SIBO, it's more like floating and eating, like you'll eat an apple and you'll be completely distended. Lots of stomach pain. I always found that with SIBO, as the day went on, it just got worse and
Mhm.
worse. I could eat breakfast and I'd be fine, but then as the day went on, I would just get worse and worse until I felt and I'd be in absolute. My stomach would be awful, but yeah.
So that's where it's if you don't also have some of these other infections and like you don't need to necessarily test to tell like the way we use our detailed like internal health questionnaires, I can probably tell you just by doing an assessment what you have and be close to spot on. We like to guess before we get somebody's test results back. We like to be like, I think it's going to be this. And a lot of the times we're pretty spot on at this point, but with overcoming it naturally, yes, like you can take the time, manage your stress, reduce added sugar, and then use those what we'd consider like functional foods. Support your stomach acid with apple cider vinegar. Maybe you take a bitter supplement. Maybe you take some turmeric, high dose fish oil, high dose vitamin D, things that you can do to support your immune system so that way it's able to overcome the overgrowth on its own. And then avoiding the things that could contribute to it, which are going to be that high sugar, oftentimes gluten, because the gluten protein is hard to digest. We also probably have leaky gut. Alcohol is a big no. So before I knew the first time, forever ago, years ago, that I had Candida, I wasn't drinking a ton. I went on a trip to see my friend and we went to a brewery and we were just like sitting there at 4 in the afternoon having a beer because I do like beer from time to time. I was like, this is when my gut was feeling really bad already. I was having inflammation, I was having headaches, brain fog, like struggling to get through the day. My poop was weird. Random foods would make me fart and it smelled like dead things. That whole thing was happening, but I didn't know why yet. We went to a brewery and I had 2 sips of a cider. So I ordered it gluten free because at that point I was already gluten free. And I had an instant hangover. And I've had clients where it's the same thing. This doesn't only happen with Candida, but it can happen with other GI issues, beta glucuronidase, liver sluggishness, whatever. it was like within 10 minutes of having a fourth of this beer, and I could drink in my day. So it wasn't that I couldn't hang, that I was like headache, had to put my head down. I needed to go home and take a freaking nap. I've had other clients where it's like instant diarrhea. So that's something too, where it's if you're gonna drink while you're expecting, while you're anticipating you have gut issues, clear liquor only. It's still probably not going to be pretty, but it'll be less symptomatic than like a beer or a wine. But
Totally.
total avoidance of alcohol is really going to be essential in order to overcome something like this for a period of time. And with clients, we introduce it back in. I actually have a client right now. He's like our token male at Girls Fuel right now, Jake, where he had Candida. And the only reason I knew is because of his weird bowel movements. And he'd occasionally have like weird stomach, like gallbladder issue pain in that area. So we tested, and sure enough, it was Candida. And we were able to go through the protocol for the 12 weeks, and it wasn't perfect because he travels a lot for work. So there was eating out. There was times he didn't know if he had gluten, things like that. But we got to a point where he wasn't having symptoms anymore. He's pooping Bristol 4 every single day. And we went into the reintroduction, added dairy and yogurt back in, no issue. Added gluten back in, no issue. And I was like, hey, you want to try having a beer? You go for it. You don't have celiac. You don't have anything that really should inhibit you from doing this again. As long as you can keep up with the habits that helped us get rid of the candida, the stress management, the high quality foods, eating those leafy green vegetables, because those are going to help with detoxification. Those are going to help with thyroid function and limiting inflammation in our body. But the biggest thing, again, is managing your gut health, because that's how we can avoid these things from happening. And that's also how we can improve our vaginal health.
Awesome. I think that you just said that very well. I was like, wow, I don't have anything else to
You
say.
know, I'm just like looking at Jess. I'm like, are you going to say something?
Like,
But
that was awesome.
the last thing we'll really go over is vaginal health. So one of the biggest signs to me that somebody's going to have a gut issue and that we're going to want to test is their vaginal health. If you come to me and you're like, I get UTIs all the time, the first thing that goes through my head is E. coli, bacterial overgrowth. And I say that cheerfully because we know why, right? So a big thing with UTIs specifically, and these aren't usually a yeast related thing, but it is commonly caused by that bacterial overgrowth or even dysbiosis. So low beneficial bacteria, high amounts of bad bacteria, because the gut vagina, I don't know what we actually call it, connection is very real. They're right next to each other. They are very connected. So our gut microbiome, our vaginal microbiome, those things are very closely related. So if we have a UTI, it could be a sign that gut dysbiosis is present. E. coli, again, is that one of those main contributors to that type of vaginal infection. Same with yeast infection. If you get a lot of yeast infections, it's very possible that you do have that candida, that yeast overgrowth. But again, it's going to be really that overall inflammatory response in your GI tract, that overgrowth of possible harmful bacteria that can contribute to vaginal health. I also had a client, this is really an interesting one, where she was pregnant and she had, I don't know if it was HPV or if it was something else popping up. And she was afraid that it was going to negatively impact her pregnancy. It might have been like a bacterial vaginosis ordeal too. That's another common one that's associated with the gut health. And we did some research together and found probiotics that were safe for her to take during pregnancy that would help avoid that infection. Because the thought is when the mother has a vaginal infection, the baby is born with the predisposition to have that infection, especially when it's like an HPV. Like most of us have HPV. It's just not always present in us. And that can be carcinogenic down the line. But we are able to supplement with specific probiotics and make some dietary changes. So by the time she gave birth and tested again for that vaginal issue, it was gone. But it did end up later that she did have gut issues and a parasite, and it translated into her breastfed baby having eczema. She also has psoriasis. So
Oh,
now that it was a parasite. So now that we're on the tail end of our parasite protocol, baby boy no longer has any skin lesions at all. Mood has improved for him. He's less fussy, less fidgety, and the mom's skin issues have almost vanished. So it's really interesting how the gut is connected to so many things. And Candida is one of those that it won't always have a super clear presentation with the gut, but that's where we also want to look at skin, rashes, itching, all of allergy symptoms. We also want to look at joint pain is another one. We also want to look at vaginal health. But to sum it up here, if you are expecting that you have Candida, The big things are going to be reducing sugar in your diet, supplementing with coconut oil, whether you cook with it or you take a pill form. Monolaurin or Lorcidin is my go-to. If you search that on Amazon, it's very cheap. And then once you've identified, hey, I think this is what it is, typically I'll recommend doing an herbal approach using different antifungals such as garlic or oregano, but do not go and supplement with these on your own if you do not know what it is. I actually got a GI map back recently where her biggest issue was low gut bugs, but she had spent so long having diarrhea that she thought she must have SIBO. So she was doing like oregano and berberine for months and months, when in reality, we needed to feed her gut bugs, not kill them. So that's where, like, work with a professional, be sure of what's happening. Again, we both are professionals and we worked with professionals to have some sanity for ourselves. But yeah, don't be supplement popping without knowing for sure what's going on. And then again, testing is helpful. It isn't always feasible. So if you feel like you might have something, but you're not sure where to start because you can't afford testing, let's definitely talk about that. But I think that covers it. We talked about what Candida is, what can cause it, what some signs are, what to do about it. Do you think there's anything we missed?
No, honestly, I think we covered everything. I think this was pretty high level. I think that we covered a lot here. Yeah.
Okay, awesome. Cool. So hopefully that gave you some education and some knowledge for yourself, some things to look out for. And as far as the Candida overgrowth goes, overcoming it naturally, again, is super possible. I haven't had these symptoms in a very long time, and I have many clients that had their last yeast infection however many months ago because they supported their gut microbiome. So that's the moral of the story: supporting your vaginal health, supporting your gut microbiome, and it really can get to a point where you don't live day to day with symptoms anymore. As impossible as that may sound, it is possible, and that's what we should all aim for. So if you liked this episode, please share it with anybody else that you think might benefit from us. Leave us a 5-star rating. Make sure you subscribe, and thank you so much for hanging out with us today.